Hello everyone, welcome back to my channel. How are you all doing today? I would like to reintroduce myself. My name is Dr. Bukola, a medical doctor who is licensed to practice in both United Kingdom and in Nigeria. In today's video, I'm going to be introducing the women series to you guys, and I'm so glad about it. The women series is going to be about me making videos on various types of medical conditions, and I'll be focusing mainly on the female reproductive system. With that being said, in today's video, I'm going to be talking about a popular medical condition which affects women. In fact, this medical condition affects 1 in 100 women in the United Kingdom. Can anybody guess what it is? The medical condition is known as Polycystic Ovarian Syndrome, popularly known as PCOS. So however, before I dive right into it, I would like to say, if you're watching me right now and you've been diagnosed with PCOS, it's definitely not the end of the world. And also, I wanted to let you know that you're not alone. So with PCOS, does it mean you will never be able to get pregnant? I don't think so. With adequate management, you would be able to get pregnant. So let's dive right into it. Like I said, PCOS is Polycystic Ovarian Syndrome. I'll break it down so that you would understand it better. Poly means multiple. Cystic means a fluid-filled sac. Ovarian means something related to the ovaries. Syndrome means compilation of symptoms. So let me define PCOS. PCOS is a medical condition in which there are multiple fluid-filled sacs in the ovaries, as well as hormonal imbalance, and also symptoms such as irregular menstrual period, inability to get pregnant, acne, weight gain, hirsutism, or also abnormal hair distribution pattern, male pattern hair distribution. So what exactly causes PCOS? At the moment, a lot of research has gone into finding what exactly is causing PCOS. Until now, nothing has been found yet. However, there have been thoughts that PCOS is related to hormonal imbalance, and also some genetic predisposition has been found, such that if your first degree relative, such as your mom or your sister, has PCOS, there is a high risk chance that you might have it as well, although PCOS is not a genetic condition. So what type of hormones are involved in this medical condition? So basically, in PCOS, there is insulin insensitivity or insulin resistance. So what is this insulin resistance? Insulin resistance means that there is adequate insulin, there is insulin in the body, however, the body is not responsive to insulin. And what does the body do in order to compensate? It produces more insulin. Insulin is a chemical which regulates blood sugar. It basically acts as a key in order for a blood sugar to cross to cells that need it. So what are those cells? Red blood cells, brain, liver, and the rest of it. So now, what happens when the body helps to produce more insulin? The testosterone level, that's the male sex hormone, also I will explain it as insulin and testosterone are best friends, such that the more insulin is being produced, the more testosterone is produced as well. And the downside of it is the same raw material which is responsible for the production of your female sex hormone, I mean your estrogen and your progesterone, is still the same raw material which is responsible for the production of your testosterone. So what happens when testosterone selfishly uses up all the raw material that's supposed to be shared equally amongst the female sex hormone and your and the male sex hormone? So how happens to the production of estrogen if there is no raw material to produce it? The production of estrogen suffers. So let me explain what happens, how that is related to you ovulating. So basically, the major hormone which is responsible for your ovulation is your estrogen. So let me explain it as your brain ovarian axis. Your brain simply produces two hormones called the luteinizing hormone and the follicle stimulating hormone. The follicle stimulating hormone tells the ovaries to start recruiting follicles in order for it to pop an egg, which is the end product of it. So as soon as the ovaries start recruiting follicles, those follicles start producing estrogen. So a surge or an increase in estrogen level reflects back to the brain and tells the brain to increase the production of luteinizing hormone. So a surge or a sudden increase in the production of luteinizing hormone causes the ovaries, those follicles, to pop an egg. And immediately that egg is popped, it leaves its shell behind, and that shell is what is called the corpus luteum. So what does the corpus luteum do? The corpus luteum produces another hormone called progesterone. So let me break it down as progesterone fertilizes the wall of your womb for possible implantation, for possible pregnancy. So now let's rewind back. So if there is no raw material to produce your estrogen, would ovulation be able to take place? I don't think so. If there is no raw material to produce progesterone, will there be any thickening or will your womb be receptive to fertilization? I don't think so. So now you see what is actually responsible for your irregular menstrual period. So now let me complete that cycle. So if pregnancy doesn't occur, the wall of the womb simply sloughs off through a process called menstruation. And if there is no pregnancy, what happens to the egg? The egg gets reabsorbed back into the body. So that's the basic mechanism that happens when you're ovulating. So everything all boils down to the raw material which must be available. That raw material, the name of that raw material is cholesterol. So now moving forward, let's talk about insulin level. So basically, if your body is producing a lot of insulin, you want to eat more, your appetite would increase. And the more you eat with no or little physical activity, you start beginning to add weight, which is one of the things responsible for the weight gain in polycystic ovarian syndrome. Now, talking about the irregular menstrual period, I've already spoken about it. What is responsible for the irregular menstrual period is the fact that there is no estrogen, there is little or no estrogen, there is little or no progesterone. And also, let's talk about the acne and the abnormal hair distribution pattern you're having. So that boils down to the fact that your testosterone, which is the male sex hormone, is increased. So anything that increases the testosterone level to an abnormal level causes you to have masculine symptoms such as acne, abnormal hair distribution in the body, hair on the beard, hair on the chest, hair on the inner thighs, hair on the tummy, just like how males have it. So moving forward, I've already discussed about the symptoms of polycystic ovarian syndrome, and unless I forget, there is also depression which is attributed to polycystic ovarian syndrome. And from the research I made, basically when you notice sudden hair growth on your body, you notice the acne, you notice the fact that your period is not regular, you start getting stressed, and all those symptoms start affecting you, start affecting your mental health, which can actually lead to low mood. So the low mood is basically due to the stress and the aesthetic parts of those symptoms caused by polycystic ovarian syndrome. So in terms of moving forward, how can it be diagnosed? Most patients who present to the health facility usually present with the fact that their period hasn't been regular, they are unable to get pregnant, and I've explained why you are unable to get pregnant because of no ovulation. If there is no ovulation, can pregnancy occur? I don't think so. If there is no ovulation, can you see your menstruation? I don't think so. So now moving forward to how it can be diagnosed. Basically, your healthcare provider would order a specific test called full hormonal assay. So they want to check the level of your luteinizing hormone, they want to check the level of your follicle stimulating hormone, your progesterone, your estrogen, your testosterone level, even your prolactin. They want to check your hormones in general. They want to do a blood sugar for you as well in order to check how sensitive your body is to insulin. Another specific test is the ultrasound scan of your tummy, which will reveal follicles on your ovaries. So now let's talk about the management. In terms of management, I usually encourage a holistic type of clinical management, which encompasses the lifestyle of the patient, the medical aspects, and management of the patient. So basically, let's talk about the lifestyle management first. Talking about dieting. So you have to eat food that are rich in fiber. I would prefer you to go see a nutritionist about your diet. But then, whenever you feel hungry, I recommend that instead of you to go eat junk food, just replace this junk food with fruits. So if you are the type who smoke, I would recommend that you stop smoking. If you are the type who takes alcohol, I would also recommend that you cut down on your alcohol intake, and also try and have enough sleep, because studies have shown that healthy sleeping pattern improves your insulin insensitivity. So your body gets more sensitive to insulin the more you sleep, and also the more you sleep and reduce stress, it should reduce the production of another hormone called cortisol. So now let's talk about the medical management of polycystic ovarian syndrome. In terms of medical management, if you're ready to get pregnant, I recommend you go see a fertility specialist who will prescribe a medication. So they usually prescribe a medication which would make your body sensitive to insulin. When your body gets sensitive to insulin, what happens to testosterone level? The body wouldn't see the need to produce testosterone, and so the testosterone level will drop. When the testosterone level drops, what happens to your ovulation? You start ovulating, which is why some women ovulate when given metformin. Metformin is a medication which helps your body to be more sensitive to insulin. And also, they usually give another medication which will help you to ovulate. What that medication does is to increase your estrogen level. And when the estrogen level increases, what happens to your luteinizing hormone? It surges and your ovary pop an egg. When ovulation happens, it means that your ability to get pregnant increases. And also, if you're not ready to get pregnant, you would likely see your menstruation, because progesterone also increases in the body. So now let's talk about those people who are not ready to get pregnant yet. So another medication which is usually recommended for those who are not ready to get pregnant is a combined oral contraceptive pill. It contains two hormones, which is very similar to your estrogen and progesterone. So it's usually taken for 10 days, and then you should expect a withdrawal bleed after you stop it. So it's usually recommended you take the combined oral contraceptive pill every 3 months in order to induce that withdrawal bleed. Studies have shown that doing such practice will help you to reduce the risk of womb or endometrial cancer. Now, let's talk about the aesthetic management, the acne, the hair on the body. For the acne, combined oral contraceptive pill also can help you reduce the acne on your face, and also you can see a dermatologist as well. There are a lot of medications that can help you to reduce your acne. And about the hair as well, there are lots of hair removal cream, over-the-counter hair removal cream that can help you to reduce the amount of hair on your body. And also there's a medication that can help you to reduce your testosterone level. Remember, decrease in testosterone level will help to decrease all the masculine features you are having in your body. Now let's talk about the mental health part, the depression, the low mood. So if you notice that you're getting depressed, I recommend you go see a psychiatrist. In fact, if you see a fertility specialist, you would definitely get a referral to a psychiatrist. So with all of this being said, I will be expecting your questions right down below in the comments. And I would also like to know, how many days is your cycle? A regular cycle is between an average of 28 days. However, 21 to 40 days cycle is also normal. So most women see their period. So what that statement means is that most women see their period every 28 days, but if your period is between 21 and 40 days, is still absolutely normal. So I got about 4 questions from my social media, which I'll be reading and I'll be answering right now. So let's go over it together. Somebody asked, Why was I given metformin? I understand metformin is usually used by people who have diabetes. Okay, so thank you so much for your question, and I would answer it right away. If you listened attentively, you'll be able to answer this question. Basically, metformin is a medication which helps to make your body sensitive to insulin. And in diabetes, there are two types of diabetes: type 1 diabetes and type 2 diabetes. What happens in type 2 diabetes is insulin insensitivity, which is exactly what's going on in PCOS as well, which was why you're given metformin in order to increase your body's sensitivity to insulin. So I hope I answered your question correctly. The second question is, does it mean I will never be able to get pregnant? Not at all. With proper medical management, using the holistic approach, losing weight, taking your diet into cognizance, exercising, weight loss, and the medication aspect, you should be able to get pregnant and carry your pregnancy to term. So the third question, I'm currently not married and not ready to get pregnant yet. However, my menstrual cycle is irregular. Sometimes I see it every 25 days, sometimes every 26 days, sometimes every 27 days. Okay, this particular cycle is normal. The fact that they say the average cycle length is 28 days doesn't mean your cycle length has to be 28 days. This pattern is normal. So far you see your menstruation at least between 20 to 40 days, it's absolutely normal. So this is a normal cycle. So the last question, I haven't seen my period for 45 days, for over 45 days. Sometimes I don't see it in 3 months. Does this mean that my period is irregular? Basically, if you are not on any type of contraception and you're having this type of cycle, I would recommend you to see your gynecologist, because this cycle is not regular. So guys, I hope you enjoyed this topic. If you do, there are several ways for you to let me know. First of all, by giving this video a thumbs up. Second, I would like to know how many days your cycle is in the comment. Thirdly, I will be happy if you can share this video on all your social media platforms, because you never know who is having this medical condition. And also, sharing this video would also let you help a lot of people without even knowing. And I know that you guys are very generous and kind. So the last thing is for you to turn on your post notification bell, such that each time I release similar content, you will definitely be the first to know. Thank you so much for watching. If you have any question, leave it right down in the comments. See you guys next time.